Today on Great Stories in Bioethics, my personal YouTube channel, we're going to talk about COVID and mistakes we made. If you don't think we made mistakes, consider Sweden, who had far fewer deaths per capita than we did, and also had far fewer deaths in responding to COVID versus what COVID actually caused. And I think we're going to have to admit that people on both sides of the political aisle made mistakes. We're probably never going to have a commission to examine this because neither side wants to admit it made a mistake and only blame the other. But we really need to learn about what we did wrong. So the first thing we did wrong is that we underestimated how prepared we were to deal with any pandemic. In 2021, according to a report at the Johns Hopkins Center for Health Security, of 195 countries in the world, it ranked America as the most prepared country to deal with COVID. And in some ways that makes sense. We had some august federal agencies like CDC and NIH. We had some major medical centers. We had some major pharmaceutical companies that could quickly make a vaccine. It seemed like we were well prepared. The second mistake we made is that we assumed that contact tracing would be a successful way to identify who was infected and who had spread the disease to someone else. Contact tracing just won't work in America. We're too individualistic. Too many of us have cell phones where we don't answer calls from strangers, and we're certainly not going to tell strangers about our intimate sexual contacts or drug contacts. So contact tracing is a failed model for tracing the spread of a disease in America. Secondly, and this is a little bit hard for someone in a medical school to admit, I believe we made a mistake by focusing on what I call the prime directive, which is in medicine, it was to save lives and prevent sickness. And many of our responses were based on the prime directive, trying to save lives, especially of vulnerable people. But saving lives and preventing sickness is not the only value. Helping the economy flourish, helping kids get educated, helping people freely enjoy life, those are other values, and we can't sacrifice everything to the prime directive. Third, there was another method for dealing with COVID. It's called focused harm reduction, and it was suppressed as bogus science, and that is a shame because by selectively trying to control the spread of COVID, the virus, to the most vulnerable people, and on the other hand, letting healthy young people just do as they wanted, could have been a far better strategy. One of the great harms of the lockdowns that came from the prime directive is that overdose deaths soared from 75,000 a year to 110,000. Deaths from alcoholism soared from 138,000 in 2019 to 178,000 in 2021. Missed appointments and postponed medical appointments, postponed surgery, probably killed another 100,000 Americans. We didn't have to have all these excess deaths as their cause. Were there excess deaths? Well, officially, 1,184,000 Americans died from COVID, but it's also true there were 400,000 excess deaths. That means that how we were responding with lockdowns and shutdowns of services also caused a lot of deaths. That's what we should learn that we don't have to do again. Just to add a footnote to this, some of the people that said that focused harm reduction was crazy was Francis Collins of the Human Genome Project and Anthony Fauci. They claimed it was just championed by fringe professors. Well, a very famous AIDS researcher, Monica Gandhi in San Francisco, pushed back hard against that, saying it had worked in San Francisco and she was basically shut down. Another way of putting this is that New York had some very, very strenuous lockdowns. Florida was relatively open, and they're about the same size of populations. And believe it or not, they had about the same number of deaths from COVID. Florida's businesses flourished. New York lost 2 million citizens during the COVID years, and Florida gained 2 million. I'm not saying they all went to Florida, but you can see where people voted with their feet. The next mistake we made is that lockdowns hurt children badly. More American children died from mass shootings than died from COVID. Closing schools for 12 to 18 months tremendously hurt children, especially poor children, especially children whose parents had to work and were left alone at home with an iPad. Kids in elite private schools still attended schools. They often were outdoors in mats, sitting on mats, but they didn't fall behind. Especially California, it really hurt kids bad. And one of the terrible aftermaths of COVID is that the absentee rate in some of the poor public schools in big cities never really recovered after COVID. The other mistake we made, and I don't know, maybe this was inevitable, because things were so politicized, there were so many mixed messages and messages that turned out to be wrong. Not only were we not prepared for the pandemic, as John Hopkins claimed, there wasn't enough PPE, personal protective gear. A lot of our supplies were rotting. At first, we were advised not to wear a mask. Then we were told that the coronavirus was just a flu-like virus. We were told that it wasn't spread by aerosols, and it was. We were told that it could easily kill children and adolescents, which was false. We were told that if you got vaccinated, it gave you what's called sterilizing immunity, meaning you couldn't get COVID. That wasn't true either. And then finally, the most famous mistake was when Fauci admitted that the 6-foot rule, that staying 6 feet apart, when I taught like this and all the kids 6 feet apart, just kind of made up, and there's no real evidence for that. Really bad for trust in public officials. Another mistake we made is that some of the people in charge were just political appointees appointed for the loyalty to President Trump and not because they were experts. The CDC made terrible mistakes. Robert Redfield was a terrible director. The CDC had no experience making tests for COVID. We had great pharmaceutical companies that had great experience, but CDC was ordered to make an American test, even though it was a perfectly acceptable German test, and CDC botched the first test, and it took them about 6 months to get a good test, and meanwhile, the virus was spreading all over the country silently, and we were blind to the spread of the virus. And a lot of it had to do with our arrogance in wanting an American test and having people appointed to run our health agencies just for political loyalty and not because they were experts. We also made errors about amplification systems. We should have learned this from the Great Flu of 1918. You can't put a lot of people together like in a Sturgis, South Dakota rally for motorcycle people or in the ceremony in the Rose Garden for Amy Coney Barrett, where a lot of people got infected with COVID, including maybe President Trump. Amplification systems spread the virus, as we saw on the cruise ships. We can't do this again. Finally, we had no plan at all to deal with allocation. There were a lot of emergency rooms. It turns out it was first come, first served. There was some kind of triage sometimes, but it was very difficult to decide who got a ventilator, who got an ECMO machine. It was almost impossible to discharge a person who was probably going to die or a younger person who might make it. We had no agreement about that. I don't know if we'll ever have agreement about that, but we at least ought to talk about it. It is estimated that in some cases, ECMO machines were wasted on people who really weren't going to make it, and we could have saved a lot more. Finally, we have kind of disregarded long COVID. Millions of Americans suffer from long COVID, and unfortunately, when nobody wants to think about COVID anymore, no one wants to think about them. We need a lot more studies. We need a lot more research. It's a very strange phenomenon in that many of them are women between the ages of 40 and 50, and we don't particularly know why. But because of our disability system, they're really at risk for not being able to get any kind of disability. We need to be more compassionate about them. It's true that hindsight is 20/20, and just going over all the mistakes seems kind of harsh. I probably would have made mistakes if I would have made mistakes if I had been in charge. It's easy to think, let's be cautious, but Sweden, Denmark, they did much better. Germany did much better at handling COVID. It had far fewer excess steps. We need to remember our mistakes so we don't repeat them. That's it for today. I hope you enjoyed it. I wrote a book about this if you want to read it, called What Went Wrong. A lot more is in there about ECMO and some of the politics of COVID.